You're watching NBC4. Live from the area's leading news station, this is News 4 at 11.
When we come back, a new stomach surgery helping people stop weight gain without the dangers of the past. News for your health tonight. A new stomach surgery is helping gastric bypass patients lose the weight that they put back on without a major risk. An Yang with our story.
In 2001, I weighed 310 pounds. I had gastric bypass surgery.
Andrea Hill-Wilkerson lost 162 pounds after surgery. She maintained that weight for more than 6 years. But last year, she noticed her body starting to change.
I saw my weight start creeping up in increments of like 10 pounds here and 10 pounds there. And it was after the death of my husband. And after a lot of emotional stress, I started picking up some bad habits. And I started watching that my clothes fit tighter. And I was thinking, oh my gosh.
Hill-Wilkerson gained nearly 40 pounds despite having a surgery that made her stomach the size of a person's thumb. Doctors say that's common for patients who undergo gastric bypass surgery. There's
a certain percentage of patients that will, over the next 3 or 4 years, just continue to start gaining weight because they've lost the restriction.
Howard University Hospital surgeon Dr. Terrence Fullman says if patients don't fully change their lifestyle and eat too much, either their stomach will start to expand or the connection between the stomach and intestines will stretch. When patients lose those surgical restrictions, it will cause them to gain weight even if they eat less. The only fix is another surgery.
With the conventional or the old way of doing it, we'd have to make incisions, and so you'd have increased chance of bleeding, you'd have increased chance of complications.
But now doctors are using a minimally invasive procedure to help patients like Hill-Wilkerson. It's called Stomaphyx, and it's helping to avoid these complications.
We don't have to dissect or operate into previous operated areas, so we're not dealing with scar tissue, we're not dealing with staple lines, we're not dealing with areas that potentially could either bleed or could not heal well and potentially leak.
Doctors insert this long tube down the throat into the stomach. Using tools attached to the tube, they're able to tighten the stomach area, fixing any part that is stretched too much.
It's a faster recovery, it's less pain for the patient, and the patient has no incisions.
It's been 2 weeks since Andrea Hill-Wilkerson underwent Stomaphyx. She says she's already lost 10 pounds. She's had a sore throat and some gas pain after the surgery, but she felt better within a few days.
Starting to lose again, it gives you that hope again. It gives you that spirit of like, okay, I can do this, I can conquer this weight loss demon.
An Yang, News 4.